Hi, I'm Paul Feiner, Greenburgh Town Supervisor.
I'm Pauline Mosley. Welcome.
And today we have a very interesting program. My guest is Adam Weissman, and Adam is a resident of Tarrytown, and he's the founding president and CEO and chief psychologist of the Child and Family Institute, and also the Weissman Children's Foundation. And I'm going to start with a question, and I know the answer to this. Is there a mental health crisis in our area?
Well, first of all, thank you, Pauline and Paul, for having me on the show today. It's great to be here with you in person. I think you know the answer. The answer is that yes, there's definitely a mental health crisis, and unfortunately, there's also a youth mental health crisis, and it's really been escalating since long before the pandemic. In fact, in 2016, the World Health Organization, Forbes magazine, tried to warn us when they reported that anxiety and depression are actually costing the world nearly $1 trillion annually. Wow. And you can imagine that number is only continuing to grow over the past decade. So we know there's an issue there. And then recently, the White House and Mental Health America reported that half of men and a third of women have experienced deteriorating mental health since the onset of the pandemic, with over 50% of young adults experiencing symptoms of depression, and women, children, and Hispanic and Black people most acutely affected.
Why?
Yeah, why?
Well, that's a good question. Why? That's a much longer conversation, but I can speak to the children piece in a moment. I do think that as far as the folks from diverse backgrounds, there's a lot of issues around equity in the mental health landscape and access to care. And we're going to probably get into that in some of the other questions because I really want to spend some time talking about that today. But there's major systemic equity issues as far as access to care. It's public health, but it's also mental health. As far as children goes, that's the thing that touches our heartstrings at the Child and Family Institute. And what we're seeing, and we talked about this earlier, Pauline, off camera, is that we're seeing that the rates of suicidal ideation are actually rising the highest amongst youth. And a recent Mental Health America report showed that half of 11 to 17-year-olds were experiencing or reporting frequent thoughts of suicide and self-harm during the pandemic. And that's obviously devastating. And what we know from decades of research is that untreated mental illness in children leads to higher high school and college dropout rates and increased homelessness and incarceration, which would obviously compromise our nation's future and further compound systemic and pervasive inequities in our society that already exist. So,
most schools have psychologists, right? And are they able to address this successfully, or should parents basically be looking and retaining the services of outside help?
I think that there's a lot of variability in the school psychology landscape and even what their requirements are to do, what their jobs are. Some of them are focused mostly on testing. Some of them are focused on more like stop by my office if you have a problem and we'll chat about it. There's less of an intensive kind of treatment-oriented approach typically in the school psychology landscape, and so, or less specialization around being able to treat OCD or treat trauma or treat, behavioral issues. Some of these things that are more difficult to, you need more specialization, and so they typically will refer out to for that. And then when the problem, we'll get to this later too, when you look in network insurance plans, you typically can't find private psychologists who specialize in these things either because of reimbursement constraints. And so then you're having to pay hundreds of dollars a session to get the actual care that you might need. And then it's even hard to figure out what you might need because you don't know if your kid has OCD or ADHD. So it's a very difficult landscape to navigate. And so, that's the short answer to your question, but there's a lot of challenges right now.
If somebody is a parent and, what are some of the warning signs, and when should a parent start thinking about getting treatment for their kids? At what age?
You can never really start too early because even with a 2 or a 3-year-old, you might be noticing some behavioral stuff and attention anxiety, separation anxiety, right? and there's a lot of great support for parents, even if you're not going to work with a 2-year-old individually or a 1-year-old individually in therapy because they can't even talk yet. There's a lot of great work that we can do with parents and lots of evidence-based strategies. And I wasn't planning on talking about this today, but I'm developing a new treatment called compassionate parent training. There's a lot of training programs out there for parents that are, parent-child interaction therapy, and they have a lot of punishment techniques in them, and they're locking kids in timeout backup rooms and all this stuff. They're evidence-based, but they have a lot of punishment focus, and so and they don't take into account the relationship between the therapist and the parent, and they're really just focused on you need to do this with your kid. You need to be a better parent, essentially. That's how some parents perceive those programs. But there's a lot you can do with parents, and you can build a relationship with the parent and lead with humility, be culturally informed, and even appropriate self-disclosure and joining, so that the parent feels empowered, and then they can then empower their kids. So even with a young child, you can do a lot of work, and that's what we're developing right now at CFI, this approach to really help parents help their kids and teach them the skills at a young age to navigate the world and build the relationships in a positive way with positive reinforcement and other things like that. So you could start young, and that's through the parents. And then as they get older, you're doing individual work as well. And there's lots of signs and symptoms that might prompt you to refer. And it could be when you see some behavioral problems at home, but not as much at school. That might often be anxiety, because the kids who are anxious typically will try to keep it together at school and let it out at home on the parents. Like, when I get home, I'm just gonna go wild, and my parents love me anyway, right? So that's usually an anxious presentation.
Yeah, it's interesting because I have a niece who's a first grade teacher in Brooklyn, and she indicated that some of the kids are so cute and so nice. Then when the parents come in, they basically are yelling and screaming at the parents, and so that's what you're talking about.
And a lot of times people will say, "Oh, my kid has behavior problems. My kid is ODD, oppositional defiant disorder," which they throw around these acronyms. But there's usually an emotional. 99% of the time with kids, they don't want to be bad kids. They want to make the good choices. They just need trouble. They need some help doing it. And there's actually anxiety or an underlying, it could be trauma, depression, underlying emotional component. And those are the kids who typically are try to keep it together at school but act out at home. And then if the kid's acting out at school as well, there might be some ADHD, there might be some other types of behavioral issues. So those are some just kind of quick
So how do you,
rules of thumb.
When you see somebody like that who is the nicest person everywhere but at home, how do you deal with that?
Everywhere but at home. So then it's a lot of working with the parents, and it's a lot of reducing accommodation around anxious and attention-seeking behaviors, providing scaffolding and shaping of behavior with positive reinforcement strategies. And sometimes you can bring in some punishment techniques, but even that we do in a positive way. So, but there's a lot of parent work that can be done to really even foster the relationship, and again, empower the parents to empower the child. A lot of it's about building confidence. The child usually has low self-esteem when they're acting out that way, and you can build the child up and sometimes build the parent up, because the anxious parent is often sometimes modeling for the anxious child as well.
And what advice would you give for families today that where they go? I see when I go to the restaurant, everyone is on their cell phone or on their tablet, and communication seems to be just non-existent among family members. And then children in their teens, or even when they go to college, they isolate themselves because they don't know how to communicate. So what tips could you give for families that are struggling to try to connect, parents trying to connect to their children, but they can't because the kids are just on social media, which is another big issue. What are some advice you'd give for those situations?
This is such a great question, and I know we had talked offline. That we had talked offline about, is the pandemic make did make the mental health crisis worse? And I actually think it did, and I actually think that another issue that's made it worse and has accelerated the mental health crisis is technology.
Really?
And both of those things have happened kind of in concert. So first we had this, lockdown for 3 years where people were isolating and weren't able to go to their college graduations and their proms or even go to daycare and build antibodies and
Right,
have
right.
healthy immune systems in the little ones. And school-age children weren't able to play with their friends outside, or they had to wear masks and do social distancing. And so that is a huge piece of what's been going on lately with the mental health crisis, but also over the last 10 or 20 years, the advancement of social media and video gaming culture, right?
Yes.
People are connecting in a disconnected way, right? And there's not as much of that organic connection that's happening. We all just came off the holidays. How wonderful was it to, a couple of years removed from the pandemic, be back with our families, back with our relatives, back with our friends, and have those moments of joy and celebration and connection and meaning. And so during the pandemic, we were missing out on a lot of that. And even here today, Paul, with you, last time we did an interview, we were on the phone or the computer. We weren't in person. It's so much nicer to be together. So we're social, human beings are social creatures. We need that connection, and the technology is another piece of what's getting in the way. And so I think it's really important to have rules and guidelines in any household around like no phones at dinner time and like some protected pockets of time, right?
I see.
Where everybody is on the same page about that. I also worry about some of this stuff, some of this media being a kind of a risk factor for addiction. And I always say like addiction is the arch nemesis of connection, and connection is the antidote for addiction. So we have to be really careful about that as well. And just when we start to go into that addictive place, to bring the connection back somehow.
Yeah, one of the thoughts that
Very
I had
good points.
is
Thank
with Facebook and social media. People are seeing their friends like on vacations, and everybody's highlighting how fabulous their lives are. And does that contribute to anxiety and stress? And could social media be a factor in making people
100%.
Depressed?
So much FOMO, right? Oh my God. We only see the best of everybody, and so we think we're supposed to be the best, and this leads to this like existential perfectionism of like life is supposed to be beautiful, and we're supposed to be beautiful, and everything is supposed to be great, and everybody is suffering silently.
Right, because I always read that during the
it's
holidays, that's the time when people get depressed because they're reading about how much fun everybody else is having
and they're
but
not
them.
having it. It's true.
Right.
So now you mentioned earlier in the show that the care that mental health care is expensive, and you have a foundation. And could you tell us a little bit about the foundation?
Yeah, absolutely. So I'll start with the Child and Family Institute. That's the organization that I had started first, and I founded in 2011. I had completed a postdoctoral fellowship up in Boston at Judge Baker Children's Center at Harvard Medical School, where I got some really cool experiences working with the top psychologists in the country on a multi-state randomized control trial and treatment development of transdiagnostic treatments for children. Transdiagnostic treatments are ways to address kids who have co-occurring symptoms, which is pretty much any real-world kid who comes into the office. Like no one's coming in for just one diagnosis. There's multiple symptoms happening in all of us. And so we develop these treatments that are transdiagnostic across co-occurring anxiety, depression, trauma, and behavior symptoms. And I was in charge at a young age and stage of my career in supervising and training folks across there's 4 states involved: Maine, Massachusetts, California, and Hawaii. And I came back to New York to start the CFI, the Child and Family Institute, and I brought with me the new treatments and innovation, and sort of created the first evidence-based treatment and research and training institute here in Westchester County that was focused on youth, and that's the Child and Family Institute. And so been doing that for however many years now. It's grown from me as a solo practitioner to a leading clinical practice research and training institute, and we actually have pioneered like a data-driven approach to individualized care. So we're like looking at one of the interesting statistics is less than 20% of therapists actually take the time and care to monitor symptoms over the course of treatment. And they don't look at things like the relationship between the patient and the therapist. Therapeutic alliance is what we call it. And they don't look at cultural sensitivity and satisfaction, which might be important indicators to if you can develop a safe and trusting relationship. So we're looking at all of that at CFI. So that's like our base, and we're finding that that folks are improving in anxiety, depression, trauma, and behavior symptoms while maintaining strong therapeutic alliance and cultural sensitivity, which is great. And more recently, I obviously noticed the gap in equity and be able to access good care. And so we started the Weissman Children's Foundation. It was like 3 weeks before the pandemic. And I had just gotten back from Mexico vacation, and I said, this is a good time to start a nonprofit. And then the pandemic hit.
Wow.
So it was obviously a really challenging time for all of us and a really hard time to start a new nonprofit organization. So we just started rolling out, and you and I talked about this, rolling out massive COVID mental health relief right away before we were incorporated, just through the Child and Family Institute, just giving services for free or highly subsidized, whatever, kind of pay what you can or don't pay at all. And we helped over 1,500 underserved children and families throughout that time.
Was this mainly local or all over? Because I saw on your website.
A lot of Westchester.
Yeah.
A lot of Westchester, in the city as well, but a lot of it was focused in Westchester County, and we were lucky to be to have some early publicity, and be honored with the county's, I think, Healthcare Heroes, 40 Under 40, and Public Health Awards. And then in my field, our peers recognized what we were doing too, because it's pretty innovative, and the DEIJ focus we have is very progressive for a field that lacks diversity. So we have 3% psychologists of color in our field. Our training programs, we have 10 to 20 doctoral students a year come through, and we graduate over 50% of students of color. So we're really,
fantastic.
So we're really trying to lead by example, and we were recognized with APA's Distinguished Contributions to Practice Award, which won the highest in our field. So,
Dr. Weissman, could you shed some light on why some subpopulations of society feel that there is a stigma to mental health? Because I think if we could understand, if our listening audience could understand that it's not a stigma, some people feel like they're ashamed to say my child has to go for therapy, or that there's like I said, a stigma associated with mental health. So could you explain that or elaborate that, or give our listening and viewing audience a more level of comfortability so that they would get this and understand that if I did get help, then this could correct so many behaviors for my child in the future. And then that not all mental health methodologies or treatment requires medication, because some parents, there's a misnomer that, they're just going to drug my kid up. I don't want my kid on drugs. So could you just explain those myths of the one that there's the stigma associated? There really is no stigma. It's just like if your kid was sick with a cold, you would get your child treated. And also the other misnomer that sometimes if your kid was sick with a cold, wouldn't you get medication for that too to get well? So it's not a drug that's going to be addicting. So I don't have the medical background. So could you explain that?
You're spot on. I mean, you said it so well. There shouldn't be a stigma, but there is. I wish we can get to. That's exactly what my whole goal for the next 20 years is to be where you're talking about, where people just get their mental health, your annual mental health checkup, just like they do their physical checkup, and it is destigmatized, and it makes perfect sense. Why are we taking care of our bodies, but we're not taking care of our minds? Exactly. They're connected, right? So to me and you, we can sit here and say, oh, that makes sense, but what's going on in society? And a lot of it comes down to trust and vulnerability. And there's different populations that we could have this conversation about. And I'm also very aware of the fact that I look like me, and I'm a male, and I'm right. But so every identifying characteristic group or demographic is going to have different feelings about this. But sometimes it's a cultural thing. Sometimes it's men who are very stubborn sometimes. And there's a male loneliness epidemic where guys are just bottling up their feelings and not talking with their people about it. So I end up actually opening up a lot of males to the concept of therapy just by being vulnerable myself. People say vulnerable is the first thing you want to see in someone else and the last thing you want people to see in you. And so I think for men, a lot of it's like they don't know how to be vulnerable. But it's also, there's also a cultural component, and there's a lot of distrust across groups from different backgrounds. And there's a lot of reason for that. Historically, a lot of the randomized control trials were tested with white college students, and so the generalization and application is not necessarily there. So you really need to, show that you're caring about folks from underserved communities or communities of color or communities who speak different languages, and say, hey, we're going to try to, do our best to be culturally informed and culturally responsive, and also train the future generation of culturally, not just culturally informed, but culturally connected, and more folks who share your story and look like you, and you can feel like you come into our therapy and you are home, you're safe. And a lot of people have bad experiences in therapy, and trust is broken early on, and then they don't go back.
If somebody has a bad experience
true.
in therapy, how do they look for what ideas do you have in terms of looking for other therapists, or how should they, how frequently should they change therapists and things like that?
That is such a good question. It is a problem that I've had with my own kids, with my own therapy. I've had to go through like 4 or 5 therapists. I have high standards because I'm a psychologist, right? But no, it's and if I have trouble with my own family navigating behavioral health, imagine what that is for the average American family. Sometimes you do have to go through 3, 4, 5 therapists to find the right fit. It is such a difficult field to navigate for parents because there's a million different types of therapists with different degrees. There's PsyDs and PhDs and LMSWs, LCSWs, LMFTs. Like, what are we doing, right? And who am I going to? And how do I even know what the right treatment is? And then there's a million treatments and a million treatment acronyms. CBT, DBT, you probably heard some of these, PCIT, IFS. So how do we find not only the right therapist, like interpersonally and intrapersonally, but the right type of treatment? How do we know we're getting the best care? And so it's a really hard field to navigate, which is why I love when people call me and ask me to help them. I spend a lot of my time pro bono just talking to people in the community, community leaders, local politicians, the occasional celebrity. It's all private and confidential. People reach out because they have loved ones that they're concerned about. And then I spend time just to say, hey, I think my purpose in this world in this lifetime is really to connect good people to good care. And I really take that, I take a lot of pride in that. So if people are having trouble navigating the system, I would really encourage people to reach out. My website is childfamilyinstitute.com. Everything is on there. We actually created that and launched it in March as a sort of like a WebMD or Mayo Clinic for mental health. So like there's tons of free education and resources and trainings. If you want to learn about any treatment or symptom, you can go to the website and find it.
That's great.
Are there any organizations that could, let's say somebody has a problem or a family member has a problem, that could give them guidance as to the type of therapist they might want to interview, or like a rating system of, therapists?
Or like what questions they should ask.
Oh yeah,
like
to know.
consumer affairs.
Yes, that's a great idea.
A rating system where that could help. So if your child has this problem, or your child has that problem, this is what you should ask, because people are probably wasting a lot of money and time getting the wrong people.
And I don't think that actually exists. But I have. I was talking to you about this before. I have this long-term vision for the nonprofit. So the nonprofit's goal is to create access and break stigma. It's a 2-part mission. But the first thing we're really trying to do is create a pro bono solution to the mental health crisis. And we do that through our training programs and helping hundreds of people through CFI. But we also want to partner with community practitioners and community practices and build a coalition of pro bono therapists, folks who can donate a therapy hour per week, and eventually have this really big pro bono solution. And for that, I have a vision of like an integrated system, like our website, where anybody who needs care can go on and maybe type in like the identifying characteristics that they prefer, the types of treatments they're looking for, the symptoms they're experiencing, and then have like actually maybe even use AI, have it match a bunch
Or
of
even
options.
like the county mental health
Or
office.
county mental
That
health
would be
office.
like a perfect
Yeah.
program
Right.
where they could basically not provide, say, oh, you have to use this person or that person, but maybe give people some guidance or that. Do you get any
More curated approach.
do you get any funding from the county?
Not yet. We haven't yet, and I think it would be important for us to do that, or maybe even partner with the county to create a centralized system that isn't just a private solution, but it could be actually a public solution.
Yeah,
right?
Because we've had like a mobile crisis team here, and the county has that. and so many of the issues relate to mental health right
absolutely.
now. So I think that would be
Absolutely.
good. So could you tell us again how we only have a few more minutes, how people could get in touch with you and your website?
Yeah, the best thing to do is to just Google. Well, actually, you just type in childfamilyinstitute.com, and at the website childfamilyinstitute.com, you'll see all the information about CFI, the practice, and the Training Institute, and our research. And you can definitely learn about every symptom, condition, treatment under the sun. And then you'll learn about the Weissman Children's Foundation, our nonprofit organization, and you'll learn about all the initiatives that we're doing. Including the COVID Mental Health Relief Initiative, but a lot of initiatives since then are Israel and Gaza Crisis Counseling Initiative, pro bono care for anyone impacted by the war in a culturally informed way. The county's faith-based mental health initiative I mentioned, we're helping put that together and to build a directory and provide pro bono care to underserved communities in the faith community, which is a partnership with the National Soul Shop for Black Churches movement. We have an early win partnership with Microsoft's Give campaign. They have a big Give campaign in October. We've raised about $20,000 so far with a Taylor Swift guitar auction, and they also do some letter writing campaigns
And you've gotten foundation funding also?
That's fantastic.
We haven't had that much funding yet, so we're really at the grassroots beginning of all this, and we encourage people to reach out if they want to get involved or join the. We're looking for actually an accountant to join the board. But at the website, you can definitely contact us for anything you need, including seeking care. But we have some new things.
Because everything is so expensive. So even if you raise like $20,000 or $30,000, that doesn't go that far really when you're dealing with mental health, right?
Yeah. Well, we found a way that if people want to go on the site and click the donate button and donate $25 a month, we found a way for that to cover one child's full course of treatment. So actually, we can do a lot with a little because of the infrastructure we've built. So,
are you familiar with the Foundation Library?
No, not.
Because it's a list of all foundations around the country, and it's a library. And I'm thinking of the types of things you're doing. Yeah. There's probably various foundations. If you spend some time, you probably could get foundations that would be willing to. Help, because you could say, they list it by categories. So It's called the Foundation Library, and I would think that would be like a good resource for you. But this is really so appreciated, and I want to thank you. And again, Adam Weissman is our guest and is the founding president and CEO of the Child and Family Institute, the Weissman Children's Foundation. And the phone number again?
Phone number is 914-439-5759.
Terrific. This has been really interesting, and I thank you very much for all the services you're providing to a lot of families and young people. And hopefully you're making a big difference in people's lives.
Thanks so much to both of you.
Thank you.